Hi everyone, my name is Dr. Mohammad Saifuddin Hashmi and I am here to discuss cervical cancer awareness with our Dr. Satish Pawar, Chief Surgical Oncologist at Kaizen Hematology Network, Care Hospitals, Hyderabad. Sir, I am just going to ask you a few questions regarding cervical cancer awareness. What is cervical cancer awareness and why it is important, sir?
Yeah. So, cervical cancer awareness is nothing but to educate our common people about cervical cancer and its importance, to detect early, and why it is important. Just the way we have eradicated polio in our country, it is very important in the future to eradicate cervical cancer also, because it is easy to eradicate because we have a vaccination for this cancer.
Okay, thank you, sir. So now the next question is, what is included in cervical cancer awareness?
We need to raise awareness about the cervical cancer first thing.
Okay.
So that means people should know what is cervical cancer. So what is cervical cancer is nothing, it is cancer arising in the mouth of the uterus, that means it is called cervix. So cancer arising there is the cervical cancer. So it takes around 10 years once the human papilloma virus, that is HPV virus, enters into someone's body, and the changes that occur in the cervix, they are called precancerous changes, and which is stage 0 of cervical cancer. So this itself takes around 10 years, and from the precancerous lesions to develop cancer, it takes another 10 years. So we have a period of 20 years where we can detect this particular dreadful disease at a very early stage. So that's why that awareness. Second thing is to promote vaccination. Why it is the HPV, that is the human papilloma virus, especially the 16, 18, 31 and 32 varieties cause cervical cancer. So there is there's a vaccine particularly which acts against these the human papilloma virus and which can be eradicated. So earlier there was a vaccine which used to prevent along with the cervical cancer even the genital warts. Now we have a nanovalent, that means including almost 9 variants of human papilloma virus. So the efficacy of the vaccine is going up to almost 90%. So it is very easy to prevent this cancer by taking vaccination. So let me talk more about vaccine. This human papilloma virus vaccine, it is ideally been taken at the age of 9 and 11 or even before puberty. There only it contains 2 doses. If it is taken below 14 and 15 years of age, both boy and girl has to take this vaccination, because although the girl suffers, the HPV virus is carried by the boy. So that's why it is important to take this vaccine. Second thing, if we take, it is recommended even before the first sexual exposure, that means up to almost 26 years also you can take this vaccine. Although the efficacy of the vaccine reduces as your age increases, but it is recommended at least for up to 45 years of age.
And sir, what complications we can see in cervical cancer?
Yeah. So far there are no dreadful complications, but as soon as you take the vaccine, you at least sit for some time, don't get up. You might have some kind of hypotension, and few people might develop some allergic reaction, just like any vaccination. After any vaccination, children get fever. So similarly, this vaccine also, you might have fever for a couple of days. So apart from that, there is no dreadful complication.
Okay, so that patient should have any lifestyle modifications in that?
Yeah. So lifestyle modification is very important to prevent any form of cancer, but especially for cervical cancer. So regarding the lifestyle modification, with cervical cancer, why it is spreading is having multiple sexual partners. So multiple sexual partners, the HPV virus enters into from one partner you transmit it to the other partner.
Okay.
And generally this virus, how does the virus enter is while during the intercourse, okay, if you will have some kind of abrasions during penetration. So from those abrasions the virus enters, and there is a junction in the cervix, between the cervix and the endometrium. There is a junction where both the epitheliums are there, the columnar and the squamous epithelium, and that is the weakest junction from where the virus enters into the body.
Okay, sir. So the last question is, most of the cervical cancers comes genetically?
No. So it is a very rare cancer where cervical cancer especially running in families is very rare. Okay. So it is not a genetically transmitted cancer.
Okay.
It is transmitted through the human papilloma virus. So apart from that, as cervical cancer vaccine is important, so the other important thing is the screening. So the screening, how do we do screening is nothing but detecting cancer at a very early stage, or detecting precancerous lesion at a very early stage. Okay. So screening is done by two methods, that is pap smear and by doing HPV DNA testing. Okay. So this is recommended for any woman who is above the age of 30 years. Okay. And if the person gets married earlier, then she should start screening even earlier. Okay. So screening, the pap test, pap smear and the HPV DNA test is done for every 5 years. If you cannot afford a HPV DNA test, then at least every 3 years you should get a pap smear done. Okay. So apart from that, say for example, you have some symptoms. Okay. If the lady has some form of symptoms, what are the common symptoms? Common symptoms are bleeding per vagina.
Okay.
And foul smelling discharge. Okay. Through the vagina. And even after taking antifungal and antibacterial, any antibiotics, still the foul smelling discharge doesn't come down. That means you should suspect you might have a cervical cancer. Apart from that, the bleeding which is there is intermenstrual bleeding. That means even between the cycles you have bleeding. Okay. And apart from that, you may have postcoital bleeding. That means after any sexual activity, if you have bleeding, then you should be aware, you should be suspicious that you might have something happening in your cervix. Okay. So these symptoms, if you have these symptoms, definitely you should consult your gynecologist so that we can detect this cancer at a very early stage. And it is one of the cancers where cure rate, if detected early, is almost up to 85 to 90%. Oh. Yeah. Okay. So that's why it is very important to detect this cancer at a very early stage.
So thank you so much, sir, for your valuable information regarding cervical cancer awareness. Hope people will understand this and the effect will be seen in coming days. Thank you.